Okay, everyone. It's 1:02, and we've got a good number of people on the call, so we'll go ahead and get started. My name is Therese Finn. I am the MDRO infection preventionist for here with the Oregon Health Authority's HAI program, and I cover, excuse me, I cover the west side of the state. Just for everyone's information, this session is being recorded. And we are very fortunate today to, so I'll be facilitating the meeting today, and then our very wonderful Katie will be acting as our tech and chat monitor. So thank you for your support, Katie. And I am going to introduce our presenters, Roza Tammer, who is the HAI epidemiologist with our program, and Laura Tsaknaridis, who is with the Oregon State Public Health Lab. And I will turn it over to them for any additional introductions that they want to do. And I will be running the slides for you today, Roza and Laura. Are you there? Can you hear me okay?
Yes, just waiting for you to get the slides up, and I just want to make sure everyone can hear and see me okay.
We can hear you just fine.
Great.
Thank you. Loud and clear.
Perfect. So we will be giving a short presentation and then lots of time for Q&A. I will start out just on the next slide, please, by going through our agenda. So I'll give a very quick overview of norovirus. It is familiar to many of us. And then I'm presenting from the acute and communicable disease prevention section side of things. So ACDP, for those of you who aren't familiar, is where our on-call epidemiologists sit, and our HAI program, it also sits within ACDP. I'm the norovirus epidemiologist for the state, and I'll be talking about our investigative guidelines, which are our guidance that we produce to help facilities and local public health authorities investigate norovirus and norovirus-like outbreaks. So we'll talk about some goals, key updates and additions, and next steps of our internal guidance updates, or our internal updates that we are making to our external guidance. And then my colleague Laura will be speaking from the Oregon State Public Health Lab, or OSPHL side, talking about the history of noro testing, lots of practical information on how to order testing, communications, our job aids, what types of tests are available, and she may also touch on some surveillance and special outbreaks if there is time. And then finally, I think we'll have lots of time for questions and discussion. So next slide, please. Norovirus, something that most, if not all of us, are very familiar with. Maybe if folks want to put a hand and just raise your hand or react with whatever you want, if you've ever managed a norovirus outbreak or contributed to the management. I'm seeing lots of hands going up. So these are non-enveloped RNA viruses. They are the most common cause of acute GI illness in Oregon as well as the United States. So from 2020 to 2025 here in our state, 63% of reported GI outbreaks in long-term care were due to noro. In Oregon, from 2020 to 2025, 33% of reported GI outbreaks in schools and daycares were due to noro. But as we all know, this is going to be an underestimate, right? Because we are not ascertaining the organism in every single case. It's highly, highly contagious. It's not inactivated by alcohol-based hand sanitizers. And single cases here in our state are not reportable, but it is important to know that all outbreaks must be reported and investigated. Oregon participates in a CDC program called NoroStat, which collects data on norovirus outbreaks from 14 sentinel states. The recent data are shown on this slide. Red line showing data for the 2025-26 season, and then it shows seasons that are especially heavy and light and that kind of median range in that gray bar. And Laura, when she speaks, is going to tell you a lot more about the organism from the lab side of things. So next slide, please. What is, oops.
Sorry, Rosa.
So what is an investigative guideline? So it's guidelines from ACDP in a standard format that includes information on our reportable organisms, guidance on how to address certain kinds of outbreaks, how to investigate single cases, and it goes through information about the organism, how to investigate it, how to control its spread, and what's required by OHA. This document, like all our investigative guidelines, really is intended for direct use by the local public health authorities, but of course it's available on our website to the public and healthcare facilities or anyone as well. So I'm curious, again, just raise hands or put a reaction in the chat. I don't want to muddy the water. So if people are raising hands with questions, maybe you can react with a heart or something different that goes away. If you have ever used or seen any of our investigative guidelines, or even if you've used or seen our norovirus guidelines. Okay, there's a handful of you. Okay, awesome. So yeah, we do make them available to anyone who might want to review them. And the context for this presentation is even if the primary audience is counties, we know we all need to be on the same page about what we're doing in our healthcare facilities and our schools and daycares to respond to outbreaks. So we began this process of updating with 3 different documents, all of which had guidance that was shared across settings. And so the goals here were to take these, 40 pages of guidance and streamline it, eliminate any inconsistencies, review and update all the lab content, and make sure, especially for this audience, that our IPC practices are well addressed. Next slide. So I believe you should all have a draft investigative guideline that has been shared with you, so you can follow along as I quickly go through this document. So what we have is one document now. It's been reduced by about a third. All of our content has been reviewed and updated, and it provides general outbreak management guidance as well as setting specific guidance for long-term care facilities, schools, and daycares. And next slide, please. And I also want to add that if you're interested in reviewing this draft and providing feedback to me, providing feedback on what we're covering during this presentation, we really do welcome hearing from you. We want this document to be useful and practical, and I'll highlight a couple places where IPC expertise might be especially helpful as well. So in terms of some key updates in addition, most of these are kind of found throughout the document or in several places, which is why I don't mention them here with a lot of specifics, but things like clarifying the audience, updating and adding citations, removing language that was outdated, merging and streamlining the setting-specific guidance, and of course, liaising with our really important partners at the Public Health Lab to make sure that everything is up to date on their end regarding logistical and operational processes, etiologic agent, and testing. And then you've already heard these updated Oregon data, but I just want to highlight for you in section 6.1 on pages 9 through 10, we have updated Oregon specific data. Laura's going to talk a lot more about all the OSPHL updates, just going back to that last liaise with OSPHL bullet. I won't go into them now. They are throughout the document, but I really want to highlight for the first of many times today that testing is encouraged in all settings. We want to test your outbreak-related stool specimens. And so now let's go to the next slide and I'll explain some of the more substantive changes. Okay, logistical and operational information. This is related to working with ACDP, what is the required and recommended documentation for each type of outbreak, and how to use the database. So I'm curious to know if anyone has any experience using our outbreaks database. It's just called outbreaks. So those of you at the county may have some experience. But I'm wondering if any of our partners at healthcare facilities have ever used the online case log. Maybe a couple people have seen the online case log. Okay, cool. So you will probably be somewhat familiar with these required and recommended pieces of documentation. And so what we're talking about here is the case log, right? So our line listing of cases associated with the outbreak. There are tools for you at facilities to enter this directly in a web-based format. If you aren't familiar with that, and that sounds like a nice option versus you know what I mean, like sending or faxing or emailing in updated line listings to your county, we are happy to support you in that at the county's discretion. And then, of course, we are always looking for epi curves. And then for certain facilities, healthcare facilities, we also look for a control measures report. So ideally, all recommended and required documentation is completed as part of the outbreaks record. So you may hear from a public health agency if something is missing from your package. And so this on the right represents new information that's in the IG that hopefully will really clarify questions about documentation. Next slide, please. Okay, and this is very quick. This reflects what is in the general outbreak investigative guidelines as well, but we were asked to provide some language explaining that, you know, in Oregon, our county health departments work directly with facilities to lead outbreak investigations. However, there are also those of us at the state who support the county and are assigned to outbreaks as well. And that would happen, you know, we can provide assistance just in general, or we can lead outbreaks if the formal request is made or if there's a multi-jurisdictional outbreak. And hopefully this just helps explain, you know, the difference between the county and the state responsibilities. Next slide, please. Case definitions, we think this information is probably old hat for most or all of you, but in the interest of completeness, I've added guidance on what is a formal case definition for an outbreak and the importance of creating distinct case definitions for each case classification used. And then finally, we do have a script in our system that assigns the etiology of norovirus to outbreaks that really match what norovirus outbreaks look like, even when we haven't successfully tested someone for noro. So I've added a little bit of information on that as well. And here we're talking about section 3.1, pages 6 through 7. Next slide, please. Okay, a little bit of information added, including some nice examples. Hopefully that will be helpful regarding lab and physician reporting requirements. So this is in section 2, page 1. It's just very brief, but we want to, you know, we can't tell in our guidance every circumstance where an outbreak would need to be reported. So hopefully this is helpful. And then the next slide, please, is very much kind of related to this, which is not about reporting outbreaks, but rather identifying outbreaks. So what are some setting specific, right, considerations that we want you all to be thinking about in terms of long-term care, schools, daycare facilities? What are some of these, you know, red flags that an outbreak may be happening? Next slide. Okay, this is probably the area where most of you will be most interested. So this is all relevant to expansion, review, updates, clarifications on our setting-specific guidance on infection prevention and control. So not all control measures have setting-specific guidance for all settings. For example, we don't include cohorting recommendations for schools and daycares because anyone who's ill should be excluded from those settings. However, I want to highlight the IPC specific changes that have been made. Number one, protection of contacts. So there was prior guidance regarding wearing shoe and hair coverings while managing vomiting cases. So that has been changed to the recommended PPE of mask, gown, and gloves only. In section 6, we had previously had guidance for long-term care facilities to wait 7 days from the end of the outbreak to accept new admissions. And now we are saying that you may accept new admissions as soon as the outbreak is over, which would be 2 incubation periods from the final case onset. In terms of restrictions and exclusions, we've updated our language to be aligned with ODE requirements. So restrictions and exclusions for daycares 48 hours from last episode of vomiting or diarrhea. vomiting, and then 24 hours is the recommendation for schools. And then regarding cohorting and isolation, we have changed the recommendation to place long-term care residents incontinent of stool, non-ill, so healthy residents incontinent of stool. Previously, the recommendation was to put them on contact precautions, so we have downgraded that to enhanced barrier precautions. Next slide, please. Okay, and then by popular demand, I also added some information on terminal cleaning. So previously, there really was no kind of definition or explanation of what terminal cleaning should constitute in the setting of a noro outbreak. So I have added just a general definition of terminal cleaning as well as some specific times when terminal cleaning should take place. So the information on this slide and the last slide, and of course this is all just a, synopsizing what's in the actual investigative guidelines, but I am so very much interested to hear, from all of you, and we'll have time for discussion, does this match up with what you do? Does this feel feasible? How can we make this more setting specific? How can we make it more practical for you? All of that is fair game. Next slide, please. I'm going to breeze through the next slide, so I give Laura all of her allotted time. I think I have 2 minutes left. So we also have added a list and guidance for use of all of the appendices, and these include things like our case log, some signage. We'll go through, you're welcome to start flipping through them. The list is on pages 18 and 19 of your document that you all have, and then all of the appendices are after the list. At the very end. So next slide, please, just to focus in on a couple of the updates that have been made. This is appendices A and B. This is signage that can be edited for both schools or daycares or long-term care facilities that you can post on your entrances to your buildings, and you can also edit it as needed. Next slide. This is our new case log. So previously there were multiple different versions setting specific case logs for noro and noro-like outbreaks. So now we've kind of consolidated and provided a nice new version that's all updated. Next slide. I've also added how to read a disinfection label. This is something I absolutely love for those of you who I've worked with on norovirus outbreaks or maybe infection control assessment and response work. I love to tell people about this infographic, and I really love to make sure people understand, how to effectively select and use disinfectants. In norovirus outbreaks, the things we're most worried about are hand hygiene and appropriate disinfection. So this is in addition to our toolkit. And I've also removed our FERPA FAQs, which are specific to schools per our FERPA partners in ODE. It's not specific to outbreaks, so that was at their request. The other thing I want to ask here is, are there any, and we'll come back to this hopefully in the discussion, but just to put the bug in your ear, are there any resources, handouts, posters, guidance, step-by-step, visual aids, things that you like to use or show your staff during noro outbreaks that we might consider? Next slide, please. Okay, and then next steps on my end, currently incorporating input. Please send me your input as well. If you want to talk through the investigative guideline with me, I will make time to do that 100%. You can reach out to me directly. We're going to have updated setting-specific control measures reports, just checklist of the important aspects of controlling these types of outbreaks. And then it will go in an updated template as well. So accessibility, links, page numbers, font, all of that stuff will come out in the wash, thank goodness. And then of course on our Virus website, we'll have all of the hyperlinks and editable signage and things for all of our appendices much more easily available. So with that being said, I will turn it over to Laura.
Wonderful. Thank you, Rosa. Can everyone hear me?
Yes.
You can hear me? Awesome. Okay. I was having technical difficulties and I apologize because my camera is not working. So you'll just have to bear with the slides. But my name is Laura Tsaknaridis, and I am one of the lead microbiologists in the virology immunology section here at the Oregon State Public Health Lab. And I'm very excited to be here for the IP Power Hour and to talk all things norovirus from the lab side. So this is first, I'm not going to go into too much detail given the timing, but this is just kind of a brief history of norovirus testing at OSPHL. It began in 1999. It was a very timely process. It would take up to about 3 days because we had to run conventional PCR along with gel electrophoresis. And so it would inhibits us to be able to, I guess, detect if an outbreak was positive for norovirus, it would delay the response. And then in 2005, we were able to implement real-time PCR, which is single-plex assay. And this allowed us to detect norovirus within 24 hours, so much more timely response. We are also a ClinicianNet certified lab, and we were one of the original Norostat labs that started in 2012. Most recently, we are serving as a ClinicianNet Outbreak Support Center, and this is to help other states who are not ClinicianNet certified to help with their norovirus surveillance tracking. Next slide, please. Okay, so why is it important to submit outbreak stool samples to the public health lab? As many of you know, illnesses cause vomiting and diarrhea. Many illnesses cause vomiting and diarrhea. Lab testing verifies the pathogen responsible. For example, norovirus can help guide to the right response. Also, sending outbreak samples to Oregon State Public Health Lab can help link cases together. If samples from multiple locations are positive from same strain and have 100% genome match, this might signal a larger outbreak. We can also further identify the norovirus genotype and track how the virus is spreading. Identify if it's an emerging strain, which can help to connect outbreaks across regions or states. Plus, testing here at the Oregon State Public Health Lab for norovirus outbreaks is free of charge, and we are accepting all outbreaks from all different facilities and sources. Next slide, please. So first, how many of you have actually submitted stool samples to the Oregon State Public Health Lab for testing? Can I get a show of hands? Okay, good. I see a few. So we have this job aid, so how to notify OSPL of the approved outbreak for testing. This is a neuro job aid that was put into use this past year and can be found at the following link, submitting enteric outbreak specimens. So this can be used not just for norovirus, but for all like other GI pathogens. This page has recently been updated, and this was developed to form OSPL of approved outbreaks for testing and to begin the coordination process for sample collection. So I'm not going to go into exactly how to use this, but the link has been provided. If we could go to the next slide, please. And if you have any further questions on how to use this job aid or link, I'm more than happy to further discuss this. But here is an example of information that you want to complete out as much as you want. And then please specify in the additional notes what type of testing is required. For example, if you want norovirus PCR or if you want the BioFire GI panel. And this will help to inform the lab what type of collection kits to send. And you should be contacted within 1 day. If you don't hear from us, please contact OSPHL so that we are aware of the outbreak. Next slide, please. Okay, so has anyone actually used our test menu our laboratory test menu? Could I get a show of hands? Yay. Okay, so here is the link to our laboratory, to Oregon State Public Health Lab's test menu. And so I'll briefly go over and how to use this. So a general search for Oregon State Public Health Laboratory should lead to the site. Select test menu search and an alphabetized list of tests performed at OSPHL will appear. Under search, type in the test you're interested in, and once entered, specific information for the test will appear. Next slide, please. So here's an example of biofire testing the GI panel. In this section, you can find if ACD approval is required for testing. Please note that this test does require ACD approval. You can also find instructions on how to order and how to download the virology test request form. Next slide. So as you scroll down, you will find specimen collection details. The handling and transport of Kerry Blair samples for the BioFire GI panel testing has recently been updated to remove ambient temperature and required refrigerator temperatures of 2 to 8 degrees Celsius. This is to provide sample stability for downstream testing. Kerry Blair samples must be received within 4 calendar days of collection for testing to occur, and only stool and Kerry Blair can be tested on the GI BioFire. We sometimes get raw stool, and we cannot run raw stool on our BioFire instrument. Next slide, please. Okay, so here is the sample collection details for Norovirus RT-PCR. The preferred sample type is raw stool, or stool Kerry Blair. Vomit is also acceptable, but not an optimal specimen as it may contain lower viral load and PCR inhibitors let's see, we also want minimum of 2 samples submitted per outbreak. It's ideal to have 3 to 6 samples. For an outbreak to be laboratory confirmed, we must have 2 or more samples test PCR positive for norovirus. And this is a fun let's see, article that was submitted back in 2011. And this article demonstrates that 3 samples were sufficient enough to confirm 91% of norovirus outbreaks collected up to 7 days of onset. And that sensitivity did drop after day 7, but remained substantial up to 14 days. Next slide, please. Okay. So here's an example of what's provided in the stool collection kit you'll receive. As a reminder, quality test results start with adequate and timely specimen collection, appropriate storage, transportation, and temperature, complete patient and submitter information on the request. Test is clearly indicated on the request and the requisition form, and at least 2 unique matching identifiers on the specimen container. And I just had to throw in the funny one of a stool in a cottage, or it looks like sour cream that exploded everywhere. That's what we do not want to see. Next slide, please. Okay, so this is another updated job aid that we're very excited about. This was to assist with proper stool sample collection. These patient instructions for sample collections are included with each kit. These instructions have recently been updated for clarity with the stool sample collection process. They have also been made available in the following languages: Spanish, Vietnamese, Traditional Chinese, Simplified Chinese, Russian, and Korean. It is important to make sure to clearly label the sample collection container with 2 identifiers, normally date of birth and first and last name. And please avoid smearing the writing after wiping off the container, because sometimes we'll get samples in and we won't be able to see the name, and it can be kind of a messy process. And we also ask that you do not overfill the sample container, especially with the Carrie Blair, just fill it up to the line. And then also please make sure that all sample containers are tightly sealed so that there is no leakage. Next slide, please. So here's an example of our test request form, the virology immunology. How many people have filled out the virology immunology test request form? Are familiar with this? Okay, I see one hand. Well, there is a link that's been provided. The main thing with here is you want to fill out all the information in red. And then the areas that have been highlighted in yellow, we really want to have, you know, if this is associated with the study or if it's associated with the outbreak number, please make sure to fill that in. And then also please make sure to order the correct tests. Do you want norovirus PCR, or are you leaning more towards this outbreak could use the BioFire GI panel? Next slide, please. So now I'm going to go over our courier services. How many people have used OSPHL's courier service that's provided? Okay, I guess not too many. So we do have, oh, good. So we have just updated a Curie service, but you can find it here at this link. And this service enables timely and secure submission of clinical specimens for laboratory testing and our surveillance activities. On June 1st, could we go to next slide, please? So on June 1st, our regional courier services transitioned to Dash. So Dash deliveries use many of the same subcontractors as STAT did, not changing the pickup timing for facilities, for most facilities except in the Columbia Gorge. But a letter of these changes was sent on May 14th. And here is an example of the courier request form for you to fill out. And you should be contacted with 1 working day. And for urgent needs, you'll please contact the number of 503-693-4100. I would like to note that OSPHL is no longer able to accommodate same-day non-priority pickups. So requests must be submitted by 5 p.m. to be considered for next day business routes. Next slide, please. Okay, so now I'm going to go over what testing are available for norovirus and surveillance. This is the BioFire Filmary. It's an FDA-cleared multiplex PCR system. This that integrates the sample preparation, the nucleic acid extraction, amplification, detection, and this is all done within about 1 hour and 25 minutes. It's very simple to use, requiring only 10 minutes of hands-on time. Okay, next slide, please. The GI panel is tests up to 22 common GI pathogens. These pathogens include 14 bacterial pathogens and then 5 viruses. If you could click the button, I think there's a little thing that happens with the viruses, or just click. There we go. Thank you. And 4 parasites. This testing can be instrumental for detecting multi-pathogen outbreaks. And just note, only stool and Carrie Blair is acceptable sample type for this testing. It is important to note that funding has been provided to test all long-term care facility outbreaks on the BioFire. So please submit your long-term care facility outbreaks and all other outbreaks to the Oregon State Public Health Lab. Next slide, please. Okay, this is the current instrument we're using for all our norovirus real-time PCR. It's the ABI 7500 FastDX. This is the primary test used for confirming all norovirus positive outbreaks and all norovirus positive BioFire samples. We also have the capability to test RT-PCR for other GI viruses such as Sapovirus, and Rotavirus. Acceptable samples for norovirus PCR testing are raw stool, stool and Kerry-Blair, and vomit. Next slide, please. Okay, so here's an example of the norovirus genome. I'm not really going to go over this, but this is kind of what continues on. So when you submit your samples to the public health lab, we then go into further surveillance, and we try to do genotyping. So which is this region B and region C is what we are typically interested in. The circular on the side, that's an actual image of the whole genome, which is 7,500 base pairs of the norovirus genome. Next slide, please. So this is the first assay that we brought up for genome surveillance, and this was a Sanger sequencing method that only captured the region B and region C, which is the capsid and polymerase region of norovirus. So it wasn't capturing the full genome, but this captured enough of the information that we needed to continue norovirus surveillance and submit to CDC. Next slide, please. Then in 2023, we went ahead and validated norovirus G2 sequencing onto the Lumina MiniSeq. We recently have just purchased the MySeq i100, and this is going to be for future validation as the MiniSeq is going to be sunsetted here soon. Next slide, please. And this is our favorite workhorse. So this is a fully automated sequencing platform system that basically for norovirus, we create a target-specific amplicon for either genogroup 1 or 2. And then the DNA product is put on to the Clear Labs platform. And this does library preparation and sequencing process that are fully automated. And then sequencing files are generated, and these are able to be analyzed in a further downstream pipeline. This automated sequencer helped us immensely during COVID to stay afloat with doing all the sequencing demands that were put onto us. So this has been a wonderful machine for us here in the lab. Next slide, please. So finally, all of the sequencing data ends up being uploaded into the National Clinicianate database. And you can see here at this link, you can find all the information and data that is uploaded nationally. This was established in 2009 to help CDC better understand norovirus and enhance norovirus surveillance, which helps to invert and prevent the spread of norovirus. The information can be used to help CDC link clusters of norovirus and illness to a common source, such as contaminated food, standardized typing of norovirus strains, monitor circulating strains, detect and identify new and emerging strains of norovirus. And here are a couple figures that are of most recent data. We can see that here in Oregon, actually, we're probably approaching now the 11 to 17 legend. But yeah, we're doing well. Let's go ahead and go to the next slide, please. Okay, so now Rosa and I would like to do an interactive kind of fun event where we test as to what test you would order and sample collection type. So I will go ahead and do on outbreak scenario 1. So all cases are ill for 24 to 36 hours with only vomiting and nausea, no diarrhea. What test would you order? Does anyone have any answers?
And if you want to come off chat or
Yeah.
come off mute or in the chat,
Or
whatever works, just shout it out.
Okay, do you think how many people would order BioFire or testing for this? Okay. So what about norovirus PCR? Well, with this one, because we're dealing, yes, thank you. Because this one, since we're dealing with vomit, that can only be ran by norovirus PCR. We cannot run vomit on the BioFire. Okay, so for, thank you. Oh, so outbreak scenario number two, the first 10 cases are all norovirus-like in terms of symptoms and illness duration, but over the next week, some new cases also present with bloody diarrhea. So what tests would you order and what type of sample would you collect? Any takers? Do you think this would be a good BioFire? Great. So yeah, we would want to do BioFire and probably order the BioFire GI panel and then do stool and Carrie Blair collection. Okay, now for outbreak scenario number three. The outbreak is reported to you after all cases have already recovered. So would you still order a test and do sample collection? If so, what type? So yes, so norovirus can shed up to 1 to 2 weeks after recovery. So testing can be performed up to 2 weeks. So either BioFire or PCR would be fine for this outbreak. But yeah, so kind of a tricky question. Rosa, do you have anything else you want to input?
I was just going to say the updated investigative guidelines will include considerations for the testing method, but we're always available to consult. So,
Absolutely, we're here.
yes.
More than happy to consult and help guide. Okay, let's see. Now, I think that is all from the lab side that I have for right now. Oh, and then this is just some of the studies and projects that we've had going on in the past. And currently, we're doing the enhanced norovirus genomic surveillance, and this is through APHL and CDC. And this is where we are sequencing norovirus whole genomes up to 5 to 10 per month to help increase norovirus surveillance nationally. So it's been a fun project to work on. But thank you everyone very much. I think now we can move on to question. Oh, yes. And this is our lovely virology immunology team. Every year we get together and do a big Halloween event. This year we were vaccine preventable diseases, and we even had some of our fun, loving epis over here come and join as rabies. So yes, you always have to have a little sense of humor in the lab. So thank you, everybody.
Well, thank you, Rosa and Laura. That was amazing and extremely interesting. I've learned a lot. And I know that there are some folks that have questions out there. Kelly, you've had your hand up very patiently since almost the beginning. So why don't you jump on and ask our experts your question? Kelly Burgott? Okay, I'm not sure where Kelly is, but we'll keep in keep an ear out for her. And then I'm wondering if anyone else that is participating have other questions that they would like to ask our experts.
Hi, it looks like there are a couple of questions in the chat. I saw Lori had a question asking, is there a diarrhea testing algorithm that can help us with choosing the right test?
Great question.
Yeah, so I already answered that one in the chat, but the updated investigative guidelines will include considerations for the testing method, and we're always available to consult, but there won't be an algorithm per se.
Great, thanks, Rosa. And then it looks like there's another question from Abigail asking, how long will we have the funding for OSPHL sample testing?
At this point, you can consider it indefinite. We will be communicating, you know what I mean, with our county partners if the funding goes away. But at this point, we have funding to test stool specimens in any setting for norovirus or norovirus-like illness, as long as we have at least 2 specimens from the outbreak to test. So if we have an outbreak of 10 people and 2 of them give a sample specimen for us to test, we will support that and do that. If only 1 person does it, we may not be able to support it. But one positive specimen does not typically constitute, in a noro outbreak. We would like to have several, and that is why we ask for 5 specimens per outbreak ideally. But if you have at least 2 per outbreak, we will test. Thank you, Abigail. We really want to see more people taking advantage of this testing.
Are there any other questions right now, Katie?
Let's see. It was also asked, can you share the slides for this training? And I believe that the slides will be sent out in a follow-up email.
Yes, so in the next day or so, I will upload the recording to our YouTube channel. We are infection preventionists, and I'll do a follow-up email that will include a link to the video that you can share with your colleagues, as well as the document that Rosa was referring to in her segment presentation. Rosa, is that the draft updated IG that you were referring to, or is that a final?
Sorry? Can you repeat the question?
You were referring to a document during your presentation. I believe it was the updated IG.
It's the draft
Okay.
investigative guidelines. There's no final version because it's in a draft form.
Okay. Is that something that it seems that you want to have shared with the group?
Yes.
Okay, so I will attach that to the follow-up email as well as all links that were provided during the session and information regarding our next meeting. I do have another question I'd like to offer, and that is, can you explain, Rosa or Laura, why norovirus spreads so quickly in these settings, even when they feel they're doing everything right?
Well, it's highly transmissible, so that's the number one thing. Most of the time when our team works with healthcare facilities directly to evaluate all of their infection prevention and control processes. And, I have never conducted one of those where there aren't some improvements to make. It's just kind of the nature of the beast, right? It's not delivering healthcare, especially in a residential setting, is never perfect. We do the best that we can. So often there are bread and butter things that we can help, intervene on. But the biggest issues with norovirus spread are hand hygiene and environmental cleaning and disinfection. We all know that hand hygiene is the most important thing that we can do to prevent transmission of communicable organisms within a healthcare setting, but it's really hard to do perfect hand hygiene every time. And it really has to happen every time. And it also has to happen with soap and water. So I think something that people do know to some extent, but don't always, think about is those alcohol-based hand rubs are part of our workflow in our healthcare environments, right? We are used to using alcohol-based hand rubs for routine decontamination. And in the setting of a norovirus outbreak, unfortunately, that's not going to be an effective hand hygiene method. So it has to be soap and water every single time. The other thing to remember is that the selection and use of your disinfectants has to be appropriate for the organism. So not all disinfectants are created equally. When you're selecting a disinfectant, and these are expensive products that take time and are not always that fun to apply, right? So you need to make sure that you're selecting an appropriate disinfectant from the EPA list. Is it G? Someone help me. But we need to be selecting a norocidal agent. And how that works is we look for the EPA registration number on our disinfectant label, enter it into that list, make sure, number one, is it norocidal? Because if it's not, all of the cleaning and disinfection you're doing with that product is not going to have any impact on the bioburden of norovirus in your facility specifically. And then number two, you need to find out the specific contact time for, thank you. Okay, that was list cheat. Goodness. Okay, I'm glad I remembered something. So you have to make sure the contact time is appropriate. So even if you're using the same product, I'm holding a fake tub of wipes in my hand right now, but even if you're using that same product for norovirus disinfection versus like COVID disinfection, the contact time may be different. So you need to make sure that you're actually adhering to and achieving the contact time for the disinfectant product that you're using for the bug that you are trying to disinfect for. And long contact time products are very, very hard to adhere to, right? If your contact time, I don't know if anyone in the room has had thank you, Lori. If anyone in the room, our virtual room, has had experience using a 10-minute or like a 7-minute or even a 6-minute contact time product. Is that something that's easy to achieve or hard? Right. Thank you, Larkin. I think that's exactly the point I'm trying to make is if it's a 10-minute contact time product and it's a hot day, right? How many times are you going to have to reapply that product in order to achieve contact time? And it's not like you can just set it and forget it. Forgive me for my like 90s, you know what I mean? Like late night advertisement lingo here, but you have to reapply before it dries. Because if you reapply after it dries, you are just doing a second contact time that isn't sufficient. So these are the types of things that really, bite us, right? When we're trying yeah, it's very difficult. So that's why we have to be looking for products that have an achievable contact time. If we want to spend a couple minutes I know we're right at the end, but I'm happy to share my screen and do a walkthrough of how to use list G, because you can sort by contact time as well. And that can be your little shopping list, but I'll stop talking and see if anyone has any interest in that or if there are other questions. And then the other final thing is sometimes your facility layout works against you. So if you have Jack and Jill bathrooms, that's going to be a very, very difficult thing to manage when you're trying to control a noro outbreak.
Thank you, Rosa. So anyone else with any questions or requests of Laura and Rosa?
Does anyone want a quick run through of how to use EPA list G?
Thumbs up if you do.
Pretty please allow me to.
We'll go ahead, Rosa.
Okay, I'm gonna do it. Okay, I got one thumbs up. Okay, so if I share my screen, Let me know. Is that working okay?
Yes.
Okay, great. So everyone can see, I'm going to just copy and paste the link into the chat, although others have done it. Thank you, Eric. I appreciate that. So this is list G. Everything on this list has a norovirus claim. So if you scroll down, you can just get a list, right? And it's listed by EPA registration number. And that's that tiny, tiny little number printed on the packaging. So I'm going to write down one of these numbers so I can look it up. Okay, so what you're going to do is you're going to find your EPA registration number on your packaging, and you're going to enter it here in the search bar, 10324-114, and there she is, right? And how long is the contact time? Who can tell me?
10 minutes.
Exactly. So this may not be a great product to use during a norovirus outbreak because you will have to achieve that 10-minute wet contact time, fully saturated and uninterrupted, in order to be sure that your product is actually doing anything. Now, the other thing you can do is, without entering anything in your search bar, you can sort by contact time. So here we go. Here's a list of all of the products that have a 30-second contact time. And it goes on and on. You can look on page 2. Okay, here we are. So we have, a page and a few extras of contact time products for Noro under 1 minute. So maybe this becomes your shopping list. You know what I mean? And you can do this for many organisms. There are several of these lists on the EPA website, and these can be very, very helpful. But the contact time and whether it's even a suitable, effective product against your organism depends on the organism and on the actual product that you're using. I hope this is helpful, just even if as a reminder.
Thank you, Rosa. I have created a pretty comprehensive crosswalk document on all of the products that happen to be on list P, which is effective against Candida auris. And the crosswalk, actually, I just show it to you really quick, and I'm happy to send this out. But essentially, this document goes through all of the disinfectants that are available in both its registration and label name, and has the EPA number on here with the contact time for each of the major lists. So, it's important when we choose our disinfectants to be able to select a product that is effective against as many organisms as possible. So I have this available that I can also attach to the follow-up email. And I see we're right at time, so we'll end the session now, and the materials will all be sent out in a follow-up email. So thank you, everyone, for participating.
Thank you.